Hey guys. Okay, so this is my video presentation for our analysis paper. I did mine over cannabinoid hyperemesis syndrome. So for those that don't remember, we did go over this at the Cody conference for everybody that was there. The lady from the CDC actually went over it, but I don't know about you, but I guess it kind of got pushed to the back of my mind, and I hadn't really thought about it until a partner of mine, we were discussing it. And it just really was a big deal, and it's becoming more and more prominent. So I wanted to go over it. So a little bit of a background: cannabinoid hyperemesis syndrome is going to be found in people or patients who are chronic marijuana users who eventually get to where they are vomiting so much that they're dehydrated and weak. Usually with a lot of weight loss as well. And another key factor is that the only temporary relief that they find is standing in a very, very hot shower or bath. The hotter, the better. So let's kind of go over a few things about it. And I tried making this video a while ago and it was way too long and it wouldn't upload, so I don't know what happened. But so many people have felt this way for quite a while. It's not new. I actually was under the impression that this was kind of a new-ish thing, but apparently this has been going on for quite some time. They've actually been doing studies on it since about 2003, 2004 was the furthest back that I could find. So like I said, they're usually vomiting so much, they get temporary relief in a hot shower. So what if I told you roll up on scene to a 20-something-year-old patient, roommate says, yeah, man, he's been vomiting for 3 or 4 days. He's in the shower right now. He's just been in there retching for like the past hour. Your patient says he has no past medical history. He's not on any medications. He has no past surgeries, nothing of note. Your patient says or reports no street drugs or legal drug use. He does report the use of cannabis though. Okay, most people just kind of throw that into the wind and there it is, right? So more than likely, most people not paying attention, and I'm not saying it is a fault, but you're going to take them in with IV fluids, probably for their dehydration, some vitals, tell the ED, and they're going to get treated for like a stomach bug or something of the such, right? So that's where our line comes into play. So we are the first part of the patient advocacy, okay? Physicians don't go on scene with patients, so we really have to use our active listening skills in order to really pay attention to what the patient's saying, what they're doing, what they mean by what they say, what's going on. All of these little things that we see sometimes as little things, they're really important. They're key factors. So you might ask why it's so important, right? Okay, so they've been vomiting, whatever. We give them some fluids, they'll be fine. Okay, well, they get temporary relief from a hot shower, but the only permanent relief is being diagnosed and stopping the cannabinoid use, right? Or cannabis use. But you're still wondering why it's so important, right? So there's 3 phases. The first phase is the prodromal phase, where your patient gets very nauseous, maybe some abdominal discomfort and or pain. Relatively mild, usually comes after years and years of smoking marijuana. The second phase is the hyperemetic phase. This is where they're always nauseous, continuously vomiting for hours at a time. Their pain is intensified. They're usually dehydrated, weight loss, right? This is the phase where the patients are also urged to take that hot shower for relief. The last phase is the treatment phase, which is pretty much, it's going to be the hardest mentally on the patient, because a lot of people who get nauseous tend to smoke more because they hope that it will alleviate the nausea, but it doesn't. So the only true treatment is the cessation of smoking marijuana. So they've also tried some anti-nausea medications, antiemetics, none with real proven relief, right? Many people go undiagnosed for quite some time or are misdiagnosed with things like psychogenic vomiting, cyclic vomiting, eating disorders, or even drug-seeking behavior. The patients are usually continuously sipping water, may or may not have a low-grade fever. They can have elevated urea, hypokalemia, and alkalosis. Whenever they do an endoscopy, they typically have trauma to their esophagus from the constant violent retching, right? So in 2018, there was a study done where they took 155 patients. Out of that, all of those 155 admitted to 20 or more days in a month of marijuana use. Out of that 155, 32.9% met the criteria for cannabinoid hyperemesis syndrome, or CHS. Okay, if you expand that figure to cover all of America, you could estimate that approximately 2.5 million Americans suffer from CHS annually. And those with severe cases have been known to spend 6 or more hours a day in the shower. That is truly extensive. So you're probably still wondering what this means for our patients long term. So we already know that marijuana can affect your digestive tract, changing the time it takes for your stomach to empty. But what it comes down to is their chronic use, their undiagnosed or misdiagnosed CHS can lead to some severe consequences, such as muscle spasms and weakness, seizures, kidney failure, heart rhythm abnormalities, shock, and in very, very rare cases, cerebral edema. So, like I said, they found some temporary fixes, but the only permanent fix is the cessation of smoking, and for the patient not to go back to smoking once their symptoms are alleviated. So, like I said, why this matters for us. It is our job to not only get the patient, treat the patient for life threats and get them to the ED, but it is our job to be the patient's advocate, to truly listen to what they say, to listen what they're trying to say, to take in their surroundings. That's why we're supposed to be situationally aware. That's why we're paying attention to our scenes. Gather all of that information, because the physician isn't on scene. The physician didn't see that you pulled this guy out of a hot shower that he'd been in for 3 hours on and off while vomiting for 5 days, right? We have to get all of that information to the ED so that these people can be properly diagnosed and treated. It comes down to us being that line of defense for the patient. So, this syndrome, though it seems kind of crazy and kind of new, even though it's been going on for a long time, it really comes down to us having that information and being able to pass it on to the physicians. So it's not only about the CHS or the cannabinoid hyperemesis syndrome, but it's also about our active listening, gathering patients' information, and really giving all of that to the ER, not just what we absorbed and thought was important. All of it is very, very important, especially in cases like this. See you guys next time.